Hi, this is Patrick Horn, president of GAP. Thank you to our sponsor, Johnson & Johnson, for their support of this Journal Club video module.
Hey there, my name is Alison Moe. I'm a PA with Atlanta Gastroenterology, which is a division of United Digestive. I've been with Atlanta Gastro for about 16 years, and my focus is on patients who have complicated and advanced inflammatory bowel disease. Our goals and call to action today is talking about Guselkumab, which is a new interleukin-23 that has been approved for patients with moderate to severely active Crohn's disease. And we're going to be talking about the GRAVITI drug trial with some 48 weeks of phase 3 data. Just some specifics of what we're talking about. Guselkumab is a dual-acting interleukin-23 P19 subinhibitor that does a pretty good job of blocking interleukin-23, and it also binds to CD64, which is a receptor on the immune cells that produce interleukin-23. The GRAVITI trial showed both IV induction with Guselkumab was effective and safe in participants with moderate to severe active Crohn's disease. And of course, we have now availability with Guselkumab for patients to have both the IV and sub-Q dosing. Specifically, there were 3 groups of patients: those that received the Guselkumab 400 milligrams sub-Q dosing every 4 weeks, and then received 200 milligrams sub-Q every 8 weeks for maintenance dosing. Another group that received Guselkumab 400 milligrams sub-Q every 4 weeks for induction, and then 100 milligrams at every 8 weeks for maintenance, and then patients that were in the placebo arm. The endpoints that we're considering at the end of our clinical induction, which is at 12 weeks, and at end of our maintenance, which is at 48 weeks, were things like PROs, which is patient-reported outcomes, endoscopic remission, clinical remission, deep endoscopic remission, and patient safety. So the average number of years of patients in the GRAVITI study that for Crohn's years was anywhere between 8 and 9. The patient's average CDAI score, which is the Crohn's Disease Activity Index score, was around 300. The patients had an average SES-CD score, which is a simple endoscopic Crohn's disease score when we're doing our endoscopic procedures, of around 12. So we were dealing with pretty severely active patients with Crohn's disease. And when we're talking about patients who were biologic-naïve, that means patients who had never previously received biologic, and where we have information about patients who have lost a response or who have previously not tolerated their biologic, we're talking about patients who had been on anti-TNFs and patients who had previously been on steroids and immunomodulators. We did see clinical remission of a difference of a delta of about 40% in patients at week 12 with both the overall population and the patients who are biologic naive separated from the patients who had previous lost immunoresponse. We saw endoscopic remission significantly, specifically in the biologic naive patients at week 12 of about 50% compared to 26%. And we saw, importantly, our clinical remission at weeks 24 and 48 in patients who were on both doses of maintenance, both the 200 milligram and the 100 milligram. As far as our endoscopic remission and deep remission at week 48, we saw about a 38 and 30% patients with endoscopic and clinical improvement compared to placebo of only about 6 or 4.3. We did not have any major serious adverse events. The ones that we noted most commonly were upper respiratory infections, but no significant superimposed infections and no severe adverse events. That is something that I would be paying attention to and looking for that would prevent patients from going on therapy. Our key takeaways, of course, for the GRAVITI trial were demonstrating that Guselkumab sub-Q induction followed by sub-Q maintenance was superior to placebo, that it was observed efficacious in both biologic-naive and biologic patients with loss of immunoresponse previously. Safety findings were consistent with the known profile of Guselkumab, and that we had options for patients to have both IV and sub-Q therapy. If you have any more questions or want more details about this GRAVITI trial, feel free to go on the GAP website and get more information.